Thank you, ladies, for attending my little service today. We are going to talk about fall prevention, okay? Everybody see the screen? Okay. All right. And I am currently a student with Northwestern University. And this is a project we have to do, okay? All right. All right. This 70 here represents the amount of falls that occur, that are the total amount of accidents that occur on the floor. Out of the 100, 70% are falls, okay? And so that's kind of large. So that equals basically out of 2.3 out of 7 falls out of every 1,000 patient days. So if you stay here 1,000 days, your likelihood of falling is you're going to have either 2.3 through 7 falls during your stay. That's a lot of falling. Okay. So how does that affect us as nursing staff here? This costs the med money. Lots of money. It means money that we don't have to supply the floor with different things that we need. That also goes over into insurance. Medicare and Medicaid does not pay us for any falls. Anything that happens that's on accident and all that, we're sorry, the patient is forgiving. It does not matter. We will not get paid. That money comes out of our pockets. So, when we're trying to find a patient that is at a high fall risk, they have two groups. It's either extrinsic or intrinsic factors working on the patients, or the patient themselves factors working outward. So for the extrinsic factors, you have patients that ambulate without assistance. No matter how much you tell them, stay in the bed, wait on me, they don't care. They're going to get up, they're going to do what they want to do. Those patients with unsteady gaits. Alright, you have the patients with the sensory altering medications. They have all the pain meds in their system, and hey, I can do whatever I want. I'm invincible. Whenever we go in and we raise the bed to do different procedures, that's a fall risk. Those that are physically challenged, they don't have full use of their arms and legs and all that kind of stuff. And the 5 T's that Ms. Pat keeps stressing to us. Make sure that they have their toileting needs taken care of, their table up close, their telephone, their trash can, tissue, all that kind of stuff. They're trying to go get those kind of things, and they end up falling trying to get those things. Some intrinsic factors are those that are cognitively impaired. Of course, they're maybe a little confused, don't know what they're doing, and they end up falling. Those that are agitated, they're being combative and stuff, and they end up falling. Those that, of course, don't follow instructions, and those with short-term memory. I know you told me don't get out the bed, but I didn't remember until I hit the floor. You told me don't get out the bed. So, a few more factors that increase the risk are our elderly patients, of course. Those, again, that are agitated. Those with a history of falling. That's very important to find out. When you get your patients in, you have to find out what is your history of falling, either at home, here at the hospital, wherever, okay? Parathyroid hormone deficiency, that also can affect it. A decrease in vitamin D can affect it, and also an increased bleeding time can also affect it. And you know how far that can go. You know, your bleeding times increase, then you fall, you break something, and you're just bleeding, and we can't control it. So, some adverse effects of falls are injury. And so different injuries range, you know, from minor to major. You might just end up with a bump or a bruise, or you can end up with something major, a broken hip, broken anything, you know. It can go all the way to disability, where for the rest of your life you now have to suffer from the results of this fall, or even death, if they fall out, I guess, the right way. So another adverse effect is the increased recovery time. Not only do they have to recover from whatever they came in for, now I also have to recover from the injury that I got during the fall. Alright, and so the main time that patients usually end up falling is during activity. They're either sitting down, reaching, getting up, getting dressed, using the bedside commode, or actually going to the restroom and they fall. repositioning in the bed, roll over, you know, they only have one side railed up and boop, they're on the floor. Getting in and out of the tub. I know our showers here have their little, what do you call it, a little ledge or something right there that you have to step over to get into the shower. And so we have to be careful about that stuff. Okay? Alright, and so we want to prevent these falls. And the way we can prevent these falls is by doing hourly rounding. That's what the research says, hourly rounding. I know here that's kind of hard to do with the patient. So I know here on the floor we have 2 hours. Every 2 hours is supposed to alternate between the nurse and the aide. And so at least every hour somebody should be going in looking at the patient asking, do you need anything? Can I do anything for you right now? I have the time to, you know, do these things for you. You also want to educate the patient, no matter if they're going to remember it or not, if they're going to obey or not. You still have to educate the patient. You also, those patients that are high risk, want to have a bedside commode. Instead of traveling all the way over to the restroom, you can hop out the bed right here and go. Those patients that are high risk of falling, we want to put them closer to the nurse's station. If that means we have to move Mr. Jones out of the room, down the hall because he's fine, that's what we have to do. Okay? We can also do tether alarms. I know those are kind of hard to come by up here. We can't find them. But if we can find them, put them on them. They get up, we'll know it. We want to make sure we also lower our beds all the way back down when we get done doing whatever to the patient. And, of course, our 5 T's, the toilet, the tissue, the telephone, the table, and the trash. Okay, we're going to pause here for a second.